Welcome back. A recent study by the American Cancer Society shows a significant rise in colorectal cancer in younger adults, with about 1 in 5 new cases now in patients under 55. I spoke to Dr. Jason Mizell, a colorectal surgeon with Baptist Health, to find out more. Dr. Mizell, thanks so much for joining me today and taking time out of your busy schedule to do this interview. Let's start with the reports that we're seeing more colon cancer under the age of 50. Are these reports accurate?
Yes, unfortunately, they are. And not only are we seeing more cancer in early people, but we're seeing when those cancers are discovered, they're found to be a bit more advanced stage. So what that means is the progression is further along, which ultimately leads to a worse prognosis. So it's not just concerning that we're seeing young people having cancer, but it's when we find it, it's a really big deal, and it potentially could reduce overall survival when we do find it.
Now, what are the possible contributing factors to seeing more cancer under the age of 50?
Yeah, that's hard to know for sure, but what we do know is that certainly genetics plays a role. You know, if somebody has a strong family history of colon cancer or rectal cancer, then that definitely can play into your risk. But all the things we know about are decreased physical activity, being overweight, smoking, alcohol consumption. Those are all things that we know certainly do lend towards cancer growth in general. And then, like I said, finding cancers at a more advanced stage.
And are there screenings available for people under the age of 50?
Yeah, so that's actually excellent news, is that colonoscopy is an amazing screening test. And even some of the stool tests that are available on the market are good as well. And when you look at colon cancer, there really is no better screening test in modern medicine than a colonoscopy. It's great. And so colon cancer is a very preventable problem. And that's the beauty of being able to screen for, is that when you find it, a lot of times you can fix it. But the commercial tests for the stool, colonoscopies, those are great tests.
And a lot of times we think of colonoscopies happening much later in life, but with these new reports, should people be getting colonoscopies earlier?
Yes, absolutely. And what we do know is that, any screening for colon cancer is good, but we know that the colonoscopies they are the best. I mean, because not only are colonoscopies helpful to find the polyps, which is what turns into cancer, but when you find them, a lot of times we can completely fix the problem at the time of the procedure. So we would say in medicine that it's diagnostic, but also therapeutic. And then if you find something, then you can know how often you should come back to get your next scopes. But now the recommended societies would say at age 45, certainly start getting everyone to get colonoscopies. There's no exemptions. Nobody gets a free pass, So at age 45, get a colonoscopy unless you have a strong family history. And then we would say 10 years below your first degree relative. So let's say you had a first degree relative that developed colon cancer at age 51, then you would need to start getting colonoscopies at age 41. So no later than 45, but sometimes even earlier than 45, depending on your family history.
Now, there are also some over-the-counter tests that can be utilized as well. Are those any good?
Yeah, they are good, actually. I mean, there's like I said, they are available commercially. You still have to have a prescription, but you get them. But they're a little gross. I mean, you do have to take your own poop and send it in and kind of mess around with it. So it's it is a big deal. And they have to be done yearly. But they are good at finding blood in your stool or some tumor markers, tumor DNA. But the problem is, if you find that it's positive, then you just have to go get a colonoscopy. So a lot of times you can just skip those kind of kit type tests, Cologuard or whatever, and just go straight to a colonoscopy. But again, some screening is better than no screening. So if you're super anxious about a colonoscopy, it's fine to do, but just know that if it's positive, you're going to end up with a colonoscopy anyway. That's the recommendation.
And Dr. Mizell, I mean, a lot of times we think about stomach pain, stomach aches as being very common. Are there any other symptoms we should be looking out for with these polyps?
Yeah, so that's a great question. And the things that really in our world, in surgery world and in GI world, that really make our radar: unintentional weight loss. We think about change in stool, like caliber, like the size of it, or the way you go to the bathroom. If you've always been a very regular person and suddenly now you're only going to the bathroom once every 3 or 4 days, or if you're noticing blood in your stool or a change in color of the stool that's consistent over time, then those are pretty big warning factors that would make us think that maybe there's something growing that's beginning to cause a blockage.
And of course, if you find yourself in that situation, then you go get tested, you go get scanned, and then you do find out that you have colon cancer or polyps. What treatment options are available?
Yeah, so surgery is the mainstay for colon and rectal cancer. And the difference, though, is that there's colon cancer and rectal cancer. We typically lump them together, but sometimes with rectal cancer, there are treatments that you would do ahead of time, like radiation to shrink it down or chemotherapy. But those treatments are very effective. But even despite those good treatments, if you wait too long to get tested and find that your tumor is advanced, stage 1, which is the best stage, has about a 90% survival. But if you wait too long to where your advanced stage, like stage 4, your survival then goes down to about 14%. I mean, that's a massive decrease. And just this year, there will be about 5-ish to 10,000, depending on the numbers you look at, of people that will die this year that are less than 50 from colorectal cancer. So, I mean, it is a big deal to find these early and to get tested.
Yeah, absolutely. For people listening to this who may find themselves with some of those symptoms, what's the first step that they can take to be proactive with their health?
So certainly, letting their primary care doctor know, and trying to get set up for screening tests. The easiest thing, like I said, is a colonoscopy, and there are groups in town that do colonoscopies. We do them here at Baptist Health. There's a place, lots of options there, and a lot of the prerequisites or some of the referrals that had to happen years ago, that has all gone away. Some of the new legislation has made it even easier. So a lot of GI groups in town here at Baptist, you can just call and say, hey, I feel like I need a colonoscopy, and they can get you set up. You don't have to go through all these hoops anymore to get set up. So lots of options there to get screened and to get checked out.
All right, Dr. Mizell, lots of great information there. Thank you so much for joining me today.
Happy to help. If you have any issues, please let us know. We're happy to help.